Okay, so welcome everyone. My name is Brittany Larrabee, Senior Health and Wellbeing Consultant at Borislow Insurance. I've been with Borislow for 6 years, and I'm excited to talk to you today about daily practices that you can take to care for your musculoskeletal system. Another short way to say musculoskeletal, because it's kind of a handful, is MSK. I'm sure you've heard that abbreviation before. So a couple housekeeping items. You will see, I just noticed that the date is incorrect on the slide, so I'll make sure to adjust that. But this is being recorded. So there will be a link sent out for anyone who is unable. My friend and my colleague Crystal is managing the chat function and the Q&A. So if you have any questions, please put those in either the chat or the Q&A. Okay. So always like to touch on the fact that from a health and well-being standpoint, Borislow really looks at health and well-being from 4 pillars. So we have physical, we have social, we have mental, and we have financial. As a consultant, our team of 3, mighty team of 3, we are here to support the holistic employee well-being as of the 4 elements I just mentioned. We help to custom design programs and really work to help ensure that you have measurable, actionable results. Okay. And if you don't already know, health and well-being is one of many different services that are available through Borislow Insurance. So today we're going to touch on 3 topics: the musculoskeletal system and what that consists of. We'll do a short quiz, and then we're actually going to put it into practice, and we're going to do some stretches and exercises today. So hopefully this will be fun, it'll be informational, and then you'll also get to move your own bodies, because sitting and being so still, especially if you have an office desk kind of job, it can be really challenging on the body. So let's touch on what the musculoskeletal system is comprised of. It is comprised of muscles, bones, joints, and connective tissue. This makes up the whole system. So starting with muscles, muscles serve many functions. Anything, which I learned this recently, from pumping blood, which we know that, and supporting movement, to lifting heavy weights and even giving birth, which it makes sense when you think about it, but wow, our muscles do a lot for us. And our muscles work by either contracting or relaxing to cause movement. So some examples of muscles, which we'll actually be stretching out and working on today, include quadriceps or quads, hamstrings, biceps, triceps, and glutes. Those are just a few of them. And we'll actually be talking today about how many bones and muscles are in the body, which is kind of fun. As far as bones, that is any of the pieces of hard whitish tissue making up the skeleton. So some things like the clavicle, your skull, pelvis, femur, radius. And then as far as joints and connective tissue, a joint is a point where 2 bones make contact, and connective tissue supports, protects, and gives structure to other tissues and organs in the body. Interesting fact, it also stores fat, helps move nutrients and other substances between the tissues and organs, and helps to repair damaged tissue. So a few examples of joints, and some of these you may have heard about, you don't need to know exactly what they are, but just to put some context, the synovial, pivot, ball and socket are all different examples of joints. And then as far as connective tissue, we have cartilage, tendons, and adipose tissue. So let's go ahead and test some knowledge. Okay. I just have to get into the poll. And I'm working off of one desktop. Oops. There we go. Pulls. Okay. So the first question, and hopefully everyone can see, the skeletal system is made up of how many bones? Go ahead and answer. Is it 156, 197, 203, or 206? Let me get my cheat sheet, which I do have. Yes, so 206 is correct for the first. The second question, there are how many skeletal muscles in the human body? And okay. And the correct answer for that is 650. So very close. The third question, muscles make up what percent of the body's weight? The correct answer is 40%. And then the longest bone in the human body is what? Femur, the thigh bone. So thank you for participating. And then, even though we kind of went through them question by question, you can still see the results. Okay. And then we're going to move right into, let me just go back, into some stretches, because as I mentioned, being stagnant sitting is one of the most challenging things on the body, and it definitely does lead to imbalances and lack of a healthy musculoskeletal system. So your cameras are off, so I encourage you really to go ahead and try these stretches with me. So what I'm going to ask you to do is go ahead and stand up, okay? And we're going to start with a standing quad stretch. Now, for those of you who know what it is, go ahead and get started. For those who need a little bit of instruction and guidance, what you'll do is you'll grab, and I know you can't see my body, but I'll walk you through this. You'll go ahead and stand. I'm standing on my left foot to begin with, and you're going to grab your foot in your hand, and you really want to think of tilting your tailbone forward. So you get a nice stretch in the hip flexor. So you can kind of see I'm trying to tilt my pelvis forward so I get a nice stretch right along here. Okay. We'll take 3 deep breaths here. 1, 2, and 3. And then we'll switch to the other side. So this time standing on our right leg and lifting up the left. So same thing, is noticing, are we arching, and then going ahead and tilting the pelvis forward. And our hip flexors get really, and our hamstrings our quadriceps get really tight when we're sitting all day long. So this is a great way to lengthen them out. I know I personally like to go for a walk and then do some stretches afterwards when my body is a little bit more warmed up. Okay, so that is our quad stretch. Now let's do some shoulder stretches. So I'm going to go ahead, and you can sit down for this or you can stand up. So we'll take our right hand, I actually like to put my opposite hand on my shoulder. We're really going to pull kind of the tricep shoulder area over. And same thing, we're going to go ahead and take some nice deep breaths. Take 3 rounds. You can even add in a nice neck stretch. And switch. So I'm also a certified yoga instructor. I'm going to be teaching some classes tomorrow for one of our clients, which will be really fun. And don't forget to breathe, because what I'm going to talk about is breathing and how important it is when we are stretching. So if we're holding our breath, kind of like I am right now because I'm talking, we actually don't reap the benefits as much when we're stretching. So it's really important to breathe. Okay, go ahead and release, shake it out. Maybe roll the shoulders backwards, forwards. Okay. Okay, chest stretch. I love this one. So if you experience any neck pain, this is a great one to do throughout the day as well. I actually was encouraged to do this from my physical therapist, so I'm happy to share with you. So what you do is I like to put my hands so they're kind of bent, see? And then what I'm going to do is squeeze my shoulder blades together, and it opens up the chest, and try not to arch your back, but it opens up the chest, and you're really activating that upper back. And then release. Let's do it again. Imagine if there's a pencil between your shoulder blades and you're trying to squeeze it so it doesn't drop. And then release, and we'll do it one more time. And relax. Okay, standing figure 4 stretch. So if you have a chair nearby, that's going to be helpful. So I'm going to stand up. Okay. I'm actually going to point the camera down so you can see my lower body. Okay, and what we're going to do is I'm going to take my ankle and I'm going to place it on top of my thigh. So my right ankle is on top of my left thigh. And then I'm going to use my chair to balance, and I'm going to sit back. You should feel this in your glute, in your hip, your low back. And this might be an intense stretch. So go ahead and really breathe into those tense spots. Two more breaths. Okay, stand up, shake it out. And then we'll switch to the other side. So your left ankle is going to go over your right knee. And we'll take 3 rounds of breath here. And it's really important that you flex the foot. So if the left ankle is on top of the right thigh, then you want that left foot to be flexed. Okay, shake it out. You should definitely feel those hips waking up. Okay, standing side body stretch. I love this one. We do a lot of forward and backward motion, but we don't always do a lot of side to side lateral motion. So for this, what we're going to do is the hands come up over the head. I'm going to take my right hand and grab my left wrist. Okay, so reaching up nice and tall. See if you can relax the shoulders so they're not up towards your ears. And then we're going to lean to the right. Take a nice deep breath. And when you exhale, see if you can go just a little bit further. You want to make sure that you engage the core. So we're not just falling into the position. It is an active stretch. Inhale and exhale, release just a little more. Okay, stand up and we'll switch. So the left arm is going to, or left hand is going to grab the right wrist, reach the hands up, relax the shoulders, and lean to the left. So I feel this right now in my abs. I feel it in my IT band. I feel it in my ribs. And if you feel any discomfort in your low back, see if you can tilt the pelvis forward. And relax. Okay, go ahead and shake it out. All right, so that is today's session. Quick and right to the point. So I hope you learned a little bit about your musculoskeletal system, what it is comprised of. You learned a few fun facts that maybe you can share with your family over dinner, because it is your body, right? That it's kind of interesting. And then some stretches. So thank you for your time today. And if you have any questions, myself and Crystal will be sticking around. There you go.